Hello. As you know, I've been observing a 4-year-old child over the last few weeks, and today I'm going to talk about the behavior characteristics that I've observed and some of the interventions that I've seen as well. And so the first one is in the area of communication, and as I mentioned in the first video, this child had an early diagnosis of speech delay, and he has had a speech and language therapist come to his house twice a week and really help him in the language area. And he's developed, he's come a long way. I knew him when he was completely nonverbal, and now he is forming complete sentences, and it's coherent, and you understand exactly what he's saying. So that's a good thing. One of the characteristics that I've observed of autism is when he does communicate, there doesn't seem to be a lot of eye contact, or a lot of, sometimes he'll ignore when he's talked to, and if he does answer, it's usually not in the direction of the person who is speaking to him. And so I've noticed that mom is really conscious about that, and if he does answer her when she asks a question, she'll usually pick up his head and say, "Remember, look at me when you're asking me a question." Or if someone else has asked him a question and he's not looking in that direction, she'll turn him around and she'll say, "Make sure that you're looking in that direction." So I think that this is a really good intervention strategy, because it's enforcing how communication works in our society. When we communicate, we tend to look at one another, facing one another. Excuse me. And really, this helps us as we pick up the cues of our facial expressions. And I think that's really one of those big pieces that I think sometimes are missed with people with autism, is that if they're not looking at people in the face, they're not able to recognize those cues that we give off all the time, that don't necessarily come from what we say. So I would encourage mom to continue with these strategies. The next one is in the area of transitioning. I've seen him transition pretty well, but I've also seen him have a hard time transitioning. And so a strategy that I've seen mom use is using the verbal cue, or the verbal countdown. And for example, one time they were playing, and they were going to get a snack. So she let them know that in 2 minutes they would be cleaning up, and then they would be having their snack. And so it was using the, first we're going to do this, then we're going to do that. And I could see it really feasible in any situation, using those verbal cues, really front-loading and letting the child know that what's going to happen next. I think we can extend it, especially as they get older, and they might need a little more enforcement. Sometimes not, but if more enforcement is needed, then the visual cues would come in. Anything from a schedule on the board to using a chart with transition cards. And then certainly there's the auditory piece that we can use as well, such as timers, setting a timer for a certain task. We're going to play for 20 minutes, and when this timer goes off, then it's back to work, or then it's time for a snack. And so using the combination of them hearing it, seeing it, will really help ease the transition as they come. And really, it's meant for everything. The home life, school environment, work environment. So I think those are really good strategies to use. The last behavior that I've observed, and I'm not quite sure where it falls under, I kind of lumped it under routines, obsessive compulsive behavior, repetitive behavior, because it's something that he does every time he starts something. So if he starts to play, he'll line up what's around him first. If you ask him to write or draw something, he'll use the space that's around him to line up objects from smallest to biggest. If it's snack time and he has more than one thing, like bunny crackers or Cheerios, he'll line up before he starts eating. And so I didn't really see any interventions for this behavior. Mom is kind of like accepting of that's just his thing. Mom does have obsessive compulsive disorder. She has a diagnosis of that. So the acceptance of maybe seeing some of her behaviors comes out. So, but I'm thinking if this was a student in my classroom, the first thing that I would probably want to monitor is the behavior impacting what needs to be done. So the timing would be a factor, and the task completion would be a factor. And so if these routines are inhibiting and distracting or putting someone behind, then I think that it really calls for those intervention strategies to come in. So I would probably set a time limit for them. If Timmy is used to sharpening all his pencils before he starts a writing task, I might beat him to the punch and say, I'm going to give you 3 minutes to sharpen whatever you need to sharpen, and when those 3 minutes are up, the writing's going to start. And kind of not let him see that we're not diminishing the behavior, but we are putting time constraints so that it doesn't impact what needs to be done. And so that is one strategy intervention that I would use for this behavior. Okay, so thank you.